It's a very good question on a very broad front, because they've got some tough decisions to make. One on at the level of the case itself, and have they misinstructed their experts, and are they going to have to retrench in a different set of charges, and they've got to take time to structure those charges and get a response from their experts. Are they going to be allowed to do that? I don't know, but it must be becoming obvious to them now that much of the original information that they were given had been misconstrued, and basing their charges on that information has been in error. At another level, they're under big pressure from the Department of Health, and David Salisbury in particular has been calling them on a regular basis, urging them to prosecute this case more vigorously against me, be nastier, be meaner, throw more in. And I know this because we get sent the unused material. And so I took the opportunity. He didn't know this. I mean, you get all the telephone conversations, all the records of conversations between people, all the draft reports, which is an interesting advantage to us. So I was able to write to David Salisbury, and I was able to say I am now in a position to have read the unused material from the General Medical Council, and I note your entreaties to them about this case. So he wrote, he was furious, and he contacted the GMC and said, I didn't know they were going to get the unused material, and you never told me, and this is a disgrace. And the wonderful thing about that is, of course, we get the documents of that telephone conversation as well. So you can see that they are under a great deal of political pressure to prosecute this case. And it's interesting that in the public domain, Dr. Salisbury has said, we don't want this to be seen to be a vendetta on the part of the Department of Health. So, mixed messages. One for the GMC, one for the public. And then the other debate, the other dilemma they have is, who do they represent in the end? Because the GMC have historically stood for the patient, patient's rights, the patient's welfare, the patient's protection from, for example, medical malpractice. Well, who do they stand for now? Because we stand for the patients. Everything that we have done is in the best interest of the children. What they're representing and prosecuting is a case not on behalf of the children. No parent has complained against us, but on behalf of the Department of Health. In other words, on behalf of public health, on behalf of this new kid on the block, the greater good. So here we have a body that has traditionally represented the patient, the victim, if you like, against the medical profession or against medical malpractice. Now they're defending the dictat of public health against the rights of the individual. So they're in a real quandary, or if they're not, they should be, about quite who they represent. Because I know who I represent, and I represent the individual patient.